Intro and AMP. Here's a surprising fact. As many as 80% of women will have fibroids by the time they reach menopause. For a condition that's so incredibly common, it's amazing how little most of us are told about why they happen. Plenty of women live with them, but very few understand the reasons behind them. In this video, we're going to break down what causes fibroids in simple terms, demystifying the role your hormones and even your family tree play. We'll separate the facts from the fiction and give you the knowledge you need. Section 1. What are fibroids, exactly? So, let's start with the basics. What exactly are uterine fibroids? Simply put, fibroids are muscular tumors that grow in the wall of the uterus. Now, the most important thing to know is that they are almost always benign, which just means non-cancerous. In fact, cancerous fibroids are extremely rare. They can be all different sizes, from as tiny as a seed to as large as a grapefruit, or sometimes even a melon. You might have just one fibroid or many of them. And while a lot of women don't have any symptoms at all, others can deal with heavy periods, pain, and pressure. That's why getting a handle on what they are is so important. Section 2. The main cause is hormones and genetics. While there isn't one single, exact answer to what causes fibroids, researchers are pretty clear that two factors play a huge role: hormones and genetics. First up, hormones. The two hormones that run your menstrual cycle, estrogen and progesterone, also seem to encourage fibroid growth. You can almost think of these hormones as fuel for fibroids. This explains why fibroids usually show up during a woman's reproductive years, mainly in her 30s and 40s, when hormone levels are at their peak. It's also why fibroids often get bigger during pregnancy when hormones surge, and then tend to shrink after menopause when those same hormone levels drop off. The second major piece of the puzzle is genetics. Fibroids definitely run in families. If your mom or sister had fibroids, your own risk of getting them is about 3 times higher than average. Scientists have even found specific gene differences in fibroid cells compared to normal uterine cells. This genetic link helps answer that "why me?" question for so many people. It's probably not about anything you did, you may just be more predisposed to them. Section 3. Other key risk factors you should know beyond hormones and genes. A few other things can increase your risk. One of the most significant is race. Black women are more likely to develop fibroids than women of other racial groups. They also tend to get them at a younger age, and they may have larger or more numerous fibroids, which can lead to more severe symptoms. Age is another one. Fibroids are most common in women navigating their 30s, 40s, and early 50s. Lifestyle also has a part to play. Obesity is a known risk factor because being overweight increases the amount of estrogen in the body. For women who are significantly overweight, the risk can be 2 to 3 times greater. Your diet has also been connected to fibroid risk. Diets high in red meat are linked to a higher risk, while diets full of green vegetables seem to offer some protection. Having low levels of vitamin D might also increase your risk. And finally, things like high blood pressure and starting your period at a very early age have been flagged as potential contributors, too. Section 4. When to see a doctor. Many women with fibroids have zero symptoms, and the fibroids are often just found by chance during a routine pelvic exam. However, for about 1 in 3 women, fibroids cause symptoms that can really get in the way of daily life. You should think about talking with your doctor if you are experiencing persistent issues like very heavy or painful periods, pelvic pain or a feeling of fullness in your lower belly, having to pee all the time, lower back pain, or pain during sex. These symptoms are not just something you have to put up with. They are totally valid reasons to get a medical opinion, figure out what's going on, and learn about your options. Conclusion and AMP. CTA. So, let's recap. We don't have one single cause for fibroids, but we know they're fueled by the hormones estrogen and progesterone and have a strong link to your family history. Other factors like your age, race, and lifestyle habits like diet and weight also play a big part. Understanding what causes fibroids is the first step toward feeling more in control of your health. It's a common condition, and you are definitely not alone in this. While hearing you have them can be a lot to take in, fibroids are manageable. The most important step you can take is to start an open conversation with your healthcare provider. They're the ones who can give you a proper diagnosis and walk you through a treatment plan that's right for you. If you found this breakdown helpful, please subscribe for more simple, clear info on women's health. And if you have questions, drop them in the comments below.